70-year-old female presented to us with pain in the shoulder and weakness. She has difficulty in lifting the shoulder and weakness as well. She is not able to do her household activity. On axial scans, we can appreciate that the shoulder is actually subluxating posteriorly. There is a deficit in the posterior cuff, so infraspinatus teres minor is also deficient. And the anterior subscap, although it looks intact, but it is almost torn in a way. If you see the biceps groove, it is lot of inflammation over there, and there is a little bit subluxation, probably a medial subluxation of the biceps due to the broken medial sling of the biceps as well. The posterior subluxation, little bit of the shoulder of the humerus is well evident. The inflammation not only spreads to the subcoracoid space, subcoracoid recess, but it also goes into the subacromial space on the axial scan. So when we see the sagittal scans, we can appreciate that a significant narrowing here. Almost the humeral head is touching the acromion, so significant narrowing. There is a loss in the muscle mass, so if you can see, there is a lot of fatty degeneration also. So if you see the tangent sign, it is broken, the supraspinatus muscle is atrophied, there is a lot of fatty degeneration. The posterior superior component is specifically deficient. So here you can see that the acromion is almost touching the humeral head. The anteriorly you can see some subscapularis, but posteriorly it is almost deficient. So posterior superior tear, predominant pathology, it is there. And when you see these images, it can be still evident that there is a very massive tear which starts from the supraspinatus area, almost narrowing of the space, little bit of arthropathy changes also which are setting in. So it becomes a very difficult case as far as the repair is concerned, but still we have discussed with the patient and we are planning to do an arthroscopy and doing a repair. These kind of cases can be managed with reverse shoulder replacement, but the patient, this was discussed and the patient was not agreeing to it. But we will take into consideration all the problems here that I just told you regarding the massive rotator cuff tear, irreducibility, superior migration of humeral head. So we may consider doing a superior capsular reconstruction if needed with the use of biceps tendon, and we might consider even a partial repair and balancing of force couples anteriorly and posteriorly. Thank you.